So for the trach care and the trach suctioning, I've got my tracheostomy kit. I've got my suction catheters inside of the kit, and that's how I'm going to start. The patient is at least a semi-Fowler's position, up to 45 degrees Fowler's. I'm going to place an oximeter on the patient's hand before I start. Oxygen is going to be monitored throughout the entire procedure. This patient happens to not need supplemental oxygen, otherwise there would be a trach collar in place. So I'm going to start by opening my kit. Inside my kit, I have my sterile gloves. So I'll apply my sterile gloves first. Open up the sterile gloves. And I scoop my second glove. And I'll get the glove packaging out of the way. Then I'm going to set up my sterile field. Got my drape. Everything inside of this kit is sterile. There's my sterile field. And I'm going to place everything in my kit on the sterile field. Got my suction catheter, my gauze, my trach tie. There's my saline. Got my peroxide packets. And then my cleaning tools. So a couple Q-tips and a scrub brush. Now inside of the kit, 3 reservoirs. I'm gonna have 1 reservoir with peroxide. And then I'm gonna add saline to that same reservoir, 50-50 mix. Other 2 reservoirs, just saline. Get that out of the way. Okay, so I have my peroxide saline mix here, and then just saline and just saline here. Now for the suction, we're going to first make sure that our patient's oximetry reading is 95 or higher. If we had to, we would add supplemental oxygen to bring it up to above 95, close to 100. This is going to end up being my dirty hand. This will be my clean hand. And so I'm going to reach and grab the suction tubing with my dirty hand, and then attach the suction catheter to the tubing with my clean hand. Plug the hole and starts the suction. I'm going to suction up some of the saline just to make sure the suction works and to lubricate the tip of the catheter. Patient's oxygen is around 100%, so I'm going to introduce the catheter until I meet resistance or the patient coughs. Patient coughs, plug the hole, and then I'm going to twirl and pull. And then I'm going to go back to the suction into the saline to clear the line of the mucus that's in the line. So finger over hole, clear the line, and if I need to make another pass, I can do so. So I'm not going to plug the hole while I'm introducing. I go in, patient coughs, plug the hole, suction, pull it out. That shouldn't take longer than 5 to 10 seconds. I'm done suctioning. I can pop my suction catheter off of the suction tubing, and I'm done with that for now. Now I can go into my cleaning and the trach care. Remove the trach cannula with my dirty hand. Drop it into the 50-50 mix. I drop dirty, I pick up clean. I'm picking up on the tube, passing to my dirty hand, hanging on to the white portion. And then I'm going to take my brush. I'm going to clean out that cannula, get the mucus out of there. Okay, and I'm cleaning the outside. Dispose of that, and then it's going to go into my rinse solution. Drop dirty, pick up clean. I'm tapping off extra saline and passing back to my dirty so that I can dry with one of my gauze pads. Dry the cannula, and then I'm going to reintroduce it to the trach. Lock it in place so it's not going to come loose. Now I don't need to worry about sterility. Now this is just a clean procedure from here on out. When I clean the stoma of the trach, I'm going to use cotton swabs, and I swear, here they are. I brought some extras. You're going to need 6 of these total. So there were 2 in your kit, and then I've got 2 packs of 2 here. So I'll pull those out and set those down. So I have 6 cotton swabs. I'm going to remove the pants, the dirty pants from the trach, put those in the garbage. And I start by cleaning, so I'm going to dip this into my 50-50 mix. And then I'm going to do 1 swipe from 3 to 9 on the stoma, dispose of my dirty one, go into another one, dip 50-50 mix, same on the top part, from 9 to 3, dispose, another clean one. This is going to be the rinse. Into my rinse, just saline, rinse out the bottom, discard, another Q-tip, rinse on the top, discard, and then my last 2 are dry. So I will dry on the bottom, swipe, dry on the top, swipe, and then I'm ready to replace the trach ties. You can put the new pants in before or after you replace the trach ties. Either way is perfectly fine. This is where I'm going to have a second nurse. My second nurse is going to come in and they're going to hold this tracheostomy plate in place while I remove my side. And then I start my new trach tie while my partner is holding that in place. I will tie my side, or use the Velcro ones. And I'm going to pass these both over to my partner. And then I'm going to take over the job of holding the trach in place while he finishes fastening the trach tie to his side. You should be able to fit a finger between the trach tie and the neck when you tighten it down. And then in my kit, there would be another pair of pants in my kit. So I'm taking my fresh pair of pants or a split drain sponge, and I'm going to go back under that trach tie and the flange for the trach and get that drain sponge in place. So that's going to help soak up any drainage from the stoma, and it's also going to create a cushion there between the skin and the trach plate. And then we're done with our trach care. Post-procedure, make sure the patient is comfortable, make sure they have the call bell, bed's in the lowest position, side rails are up, wash our hands, and then document the procedure.